do need that. You do need that. Hi. Thank you, Chris. I have great admiration for for ACI. I've really enjoyed everything I've done with you guys. I'm going to actually speak about a patient-centered medical home really only in the context of behavioral health integration, because the wonderful thing about this model is that it's got so many different places. The idea is really to serve everybody that's in our practices, and I think your introduction was spot on, as you guys say. It's not our expression. If you would like to learn more about what a more traditional look at a patient-centered medical home is, Rhiannon and I had a really good time earlier this week doing, I think it's a podcast, right? So you just have to listen. You can do it while you're driving, though. I think it's still safe unless you're under 40, so it's actually no longer safe for me. That's actually an exploration of what is the model and how might it apply to the Australian context. So humor me, but feel free to get me at the question and answer section if you really like. So I am actually a doctor. I'm a GP. I really love what I do. I refuse to stop seeing patients. It's actually what feeds me and makes me the happiest in my day. This is me with a couple of my patients. Today I do want to give the rationale for why we have engaged in integrating our medical home with behavioral health. We call it behavioral health, you call it mental health. We called it mental health, we were told we have to call it behavioral health. You might have to call it behavioral health when I call it mental health. But it is actually the important work of trying to make sure that we take care of the psychological, emotional, and spiritual part of our patients. And we take that quite seriously, so forgive the term, but I also call doctors providers because that's what we call them in my world, so just do the translation. Usually I actually have a good friend, Wally Jamal, who is actually around as my official translator, so that when I say things people don't understand, he actually pops up and explains it to you, but I don't think we're going to have the benefit of his expertise right now, so you're just going to have to do it yourselves. I'm going to get into quite a level of detail about how we do this, because I know that you guys are actually doing the work, and I think that that's probably how I learn best, is when I see someone doing it, and then I steal shamelessly, right, and adapt. So feel free to take anything of use today. I hope I give you things that are of use, and at the very worst, I guess, I get to feel like I am part of a larger community in doing this work. I really don't like reading slides. You've probably already noticed, so you will get them afterwards, and feel free to read to your heart's content. We are, I think, all recognizing that the folks in this room, that the primary care is the de facto mental health care system. We've known that for a very long time as GPs, and you simply did your best. And that sometimes felt really inadequate and very depressing. And I'm happy to say I no longer have to feel like that every day. It's not nirvana where I practice and work, so there are still days where that is what I get, but mostly I have a better plan, which is really unusual for the United States and quite pleasant. Generally our plan is no plan, as you guys are aware. You guys in general have wonderful plans, and I'm hoping that you take as much as you can and do what you usually do with it, which is bring it to scale in a very beautiful way. I'm not going to spend a lot of time on why integrate, because I feel like you actually either paid or showed up or, for some reason today because you know this, but I do want to just point out a couple things that might be a little different in the United States than Australia. I'm getting to know your country a little. It's really fun to get to know you guys. You're fun. Australians are fun. I don't do things unless they're fun, actually. That's one of my personal mental health rules. We in the United States have really big access problems to psychiatric care and to primary care both. I think you guys have better access to primary